In an ideal world, GPs would recognise chronic rhinosinusitis. They may or may not be able to diagnose the polyps. If they're sticking out through the nostril, then a quick look up the nose will demonstrate that they're there. But most GPs will not have a nasal endoscope, nor will have access to a CT scan, so a firm diagnosis is not possible. However, treating people with nasal polyps with topical nasal steroid sprays and/or nasal irrigation with saline or salt water is certainly a very good first step, and that will clear up an awful lot of people without any need to see a specialist and keep the patient symptom-free as long as they're taking their medication. Clearly, with regards to any other chronic disease, lifestyle matters are very important as well, so stopping cigarette smoking, weight loss, inadequate diet, rest, and so on and so forth are all part and parcel of the package of making the person better as a whole. The big skill is adapting your communication method, your communication channels to that of the individual patient. Their level of comprehension, their level of understanding, their level of expectations, which you should gather during the course of the consultation. Using words that the patient doesn't understand is not helpful. And also with those who are much more skilled and who know an awful lot about their disease and are able to express themselves and to ask the questions which they feel need to be asked, and then you may or may not have the answers. And if you haven't got the answers, then the thing is to either try and look them up on the screen on your computer at the time, which is something which should be done, or to refer the person to a specialist for further investigation, evaluation and treatment. I personally believe that specialists have a large role to play in terms of furthering the education of primary care in ears and throat problems generally. We don't receive much education as undergraduates. There's very little education as postgraduates in primary care with regards to ear, nose and throat disorders, and yet they form quite a large part of our workload. Other specialists, cardiologists, respiratory physicians, gastroenterologists come out and give talks, but actually the numbers of talks given by ear, nose and throat specialists, certainly in my country, it would be quite limited.